this is what we are doing, is the dissection of the popliteal fossa. Popliteal fossa, we all know, is a diamond-shaped fossa situated on the ventral aspect of the knee joint. It is bounded above and below. Its superolateral boundary, this one, is formed by the biceps femoris, tendon of biceps femoris, formed by the union of long head and the short head of biceps femoris. Whereas the superomedial boundary is formed by semitendinosus. This one is semitendinosus, and just below that is the semimembranosus muscle. Now coming to inferolateral boundary. Inferolateral boundary, this one is plantaris muscle. So this one is lateral head of gastrocnemius, and this one is medial head of gastrocnemius. Lateral head of gastrocnemius, it arises from the lateral surface of lateral condyle of femur, whereas the medial head of gastrocnemius, it arises from the popliteal surface of the femur. Its inferomedial boundary is formed by the medial head of gastrocnemius muscle. Roof of the popliteal fossa is formed by skin, superficial fossa containing 5 structure. From above downward, it is please bhai sahab. Please, that is 2P, then 1V, and then 2S. What is 2P? That 1P is, this one is what we are seeing, is the sciatic nerve. This one is sciatic nerve. One of its cutaneous branch, here you can see this one is the cutaneous branch. Here, this is torn. This is the posterior cutaneous nerve of thigh, which comes along with the substance of the sciatic nerve and also known as lesser sciatic nerve. It gives cutaneous supply of the popliteal fossa, posterior cutaneous nerve of thigh. And from somewhat medially, there comes posterior division of medial cutaneous nerve of thigh. इधर दिखाइए थोड़ा सा. Here you can see this one, posterior division of the medial cutaneous nerve of thigh. Both of this please forms please. Then comes bhai. Bhai, this one is small saphenous vein. A small saphenous vein draining into the popliteal vein. This one is popliteal vein having one tributary, that is a small saphenous vein. Please, bhai, that is vein. Sahab, that is sural nerve. This is sural cutaneous branch of the common peroneal nerve. Here we can see this is sciatic nerve. It divides into two. This one is tibial, which crosses from superior angle to inferior angle, and this what we are seeing, this one is tibial nerve, and this one is common peroneal nerve. This is, whole of this is sciatic nerve. From superior angle to inferior angle, this nerve is tibial nerve, and this somewhat going laterally is the common peroneal nerve. One of the cutaneous branch, that is the sural cutaneous branch of the, here is the, this one is torn, sural cutaneous branch of this one, sural cutaneous branch of the common peroneal nerve, and this one is the sural cutaneous branch of the tibial nerve. Both of these unite to form sural nerve, which accompany the small saphenous vein. Both of these run together, this sural nerve and a small saphenous vein. Sural cutaneous branch of the common peroneal nerve, this one is going laterally, is the common peroneal, and this is tibial, so sural cutaneous branch of the tibial nerve. Both of these unite to form sural nerve, which accompany small saphenous vein. So please bhai sahab. Okay, now is floor of this popliteal fossa. यहाँ एकदम अंदर की तरफ दिखाना होगा आपको थोड़ा सा. यहाँ this one, जहाँ मेरा जा रहा है, दिखाई दे रहा है? यहाँ हाँ, this one is the popliteus. This one is popliteus muscle having popliteal sheath above. covered with the popliteal sheath. This glistening white structure is the popliteal sheath. And in between this is oblique popliteal ligament, and above is the popliteal surface of femur. This forms the floor of popliteal fossa. Popliteal surface of femur, oblique popliteal ligament, and popliteus muscle covering the sheath. Suppose this is a house, and most in front, if we take this popliteal fossa in anatomical positions, most anteriorly father is standing, pops. Okay. Now, what is the content of this popliteal fossa? It is mother. Mother name is Navya. That is NVA. This is nerve. Then comes vein. This is vein. And just below that, this one is artery. This one is artery. Both are in one sheath. This one. दिखाई दे रहा है अच्छे से? So, most superficial is the nerve, then comes vein, and then comes, this one is artery, NVA, Navya, mother's name, okay? Or you can see, this is most laterally, this nerve is most laterally, then comes vein, and then comes artery position. So, lateral to medial, what is the arrangement of a structure? It is first nerve, then vein, and then artery. All these nerve, vein, artery has got OMG branches. Oh my God. It is not O. O is very much similar to C. So CMG. That is, it has got, all has got cutaneous branch, muscular branch, and genicular branch. This here, here you can see, this is the superolateral genicular artery. What I am holding is the superolateral genicular artery, and on the medial side there is superomedial genicular artery. Here, superomedial, and in the middle, both vein and artery is all together. This is middle genicular artery along with the vein. And inferiorly, this is inferolateral genicular, and here is inferomedial genicular artery and vein. Okay? But in case of nerve, this what we are seeing is the medial is the tibial nerve, and this is common peroneal nerve. Tibial nerve, again CMG branches, cutaneous branch, muscular branch, and genicular branch. So, it gives superior genicular nerve, middle genicular nerve, and inferior genicular nerve, but medially. Supromedial genicular, middle medial genicular, and the inferior medial genicular. And this common peroneal nerve gives lateral CMG branches, that superolateral genicular, middle lateral genicular, and inferior lateral genicular. Okay? So, these are the boundary and content. Now,